Make America healthy again. That's the call coming from top officials in the Trump administration and the mission of some Republican lawmakers here in New Hampshire. On that front, there is legislation in the state Senate filed as a ban on candy and soft drinks for recipients of SNAP food assistance benefits. That bill was just overhauled with an amendment this last week, with some Republicans saying it's a lot easier to say let's ban junk food than it is to actually just ban junk food under SNAP. Here this morning to discuss this issue are the bill sponsor, Senator Victoria Sullivan of Manchester, and Senator Sue Prentice from Lebanon. Thank you, Senators, for joining us.
Thank you for having us.
Thank you.
So let's start with you, Senator Sullivan. Tell us why this is a good idea.
Well, when you look at the data on this, again, MAHA, Make America Healthy Again, and I'm very grateful to Robert Kennedy Jr. for everything that he's doing right now, bringing attention to, I think, bipartisan issues when it comes to food dyes and coloring and the things that we're eating. But when you look at SNAP benefits and how they've been used over the years, when SNAP first came out, they didn't exclude soda because they didn't think that people would actually spend their money on that. Because don't forget, the N in SNAP is for nutrition. This is a supplement for people that are really struggling and need to put food on the table. Also back then, soda did not look like it does now. It didn't have high fructose corn syrup. It wasn't junk. It did have herbs and roots in it. It was more of an elixir. But they really had a conversation, back doing my research, about whether they should ban soda, and they just did not think that people would use it. Now, 10% of all SNAP benefit reimbursements are soda. 20% are soda and junk food.
Senator Prentice, the opposition, why is this not a good idea? The original bill.
So I think we can all agree that when we look at the food, the nutrition pyramid, that we want to be up at the top with nutritional foods and promotion of and incentivizing, healthy choices. And we can all agree on that. Why it isn't a good idea is because it is a kind of a gavel approach to something that needs a surgical look. So I would agree that these high fructose corn syrups and some of the other ingredients in some of the sodas that they have today, and when we talk about candy, they are not where we want to incentivize eating. We want to go for the healthier food products, but the approach to it is where I disagree, and I think that there's another way that we can, there's a way we need to look at this and approach it without jeopardizing those that are currently receiving these benefits.
And Senator Sullivan, where do you draw the line in terms of candy or soda? Because I know I had some items that I thought I was doing better at eating a little bit healthier than I looked at
the label,
and it's a bunch of sugar. So where do you draw the line?
And I think that we're all paying more attention to the labels. I mean, as a mom, I read labels, and I know high fructose corn syrup is one of those things that's really hard to avoid in many foods, and people don't always understand that turns into fat in your liver. Like, it's very bad for you and bad for your children. But we can incentivize people, but the fact is that these soda industries are making over $12 billion a year on SNAP. And they are spending a lot of money marketing in the beginning days of the month to make sure that they are more than incentivizing. They're really marketing toward the lowest income people that go in the beginning of the month with their benefits to get them to buy these things. They have zero nutritional value. Again, the N in SNAP is for nutrition. Soda and candy have zero nutritional value. We're not reinventing the wheel here either. I think this is more of a surgical approach because we're just looking at soda and candy. In other states, they've actually gone further, but we're allowed to define what that is. In many states, candy is anything that doesn't have flour in it, right? So candy bars and things like that, hard candies, and soda. I think we all know what that, where that is. But when I was also doing the research on this, I had a lot of people push back on me and say that, people in this income bracket can't afford to eat well. Well, when you break it down, a bag of potato chips costs about $5 now, right? And we can get a bag of apples for less than that. If you look at water versus soda, you can get 36 bottles of water for about $7, and for 12 cans of soda, it's about $9 now. So it's actually not more expensive to eat well.
And Senator Prentice, you mentioned incentives. What are some of the ideas there, and is there proof that it works?
So I just want to draw back first and talk about the big picture, if I can. I think we can all agree that a candy bar, and it's interesting that different types of candy bars, like a Twix is considered okay, but a Hershey's bar is not. That a candy bar or a sugary soda is not of nutritional value. I think that's pretty clear. But SNAP applies to all types of food that our families that are recipients, adults and children, are going in and purchasing so that they can feed their families. So anything that we do when we look at this, we just want to make sure we do not destabilize the current system and lose people from this program. So I wanted to just draw back and say, okay, candy and soda is one thing, but there is a larger picture that we need to take into consideration here.
And yet we have an obesity problem in this country, diabetes. Why should we be subsidizing the food that is fueling this healthcare crisis?
Well, we can have a conversation about what we should and should not be subsidizing through this commission, which I believe is the real surgical approach to the issue, because we're going to look at, what the, how do we incentivize, and I'll respond to that, how do we incentivize more healthy eating? What are the types of foods that we should be prioritizing? How do we support the retailers that are, the family community supermarkets as well as the larger chains, into being able to bring a program like this in and apply it so that they can still participate versus backing away from it. Now, when you talk about incentivizing it, a few years ago in the state Senate, we passed a bill that expanded the ability to use your SNAP benefits at your local farmers market. And what do we have there? We're supporting our agriculture community. We have locally grown vegetables, dairy products and meats. I know in my area, in my district, there's a number of communities that have really robust farmers markets. Those are the kinds of things that we can think about doing, that we're already doing, but through a commission like this, we can really zero in on what are the best practices, and the types of stakeholders that will be at this table are not just legislators. They're folks that came in and spoke to us, both for and against, like people from food banks, from nutrition programs, from the Department of Health and Human Services, from the retailers, to get us, if we're going to do something like this, not lose any of the current recipients that are on the program, but make it better to work. That's who we need there.
Senator, go ahead.
Yeah, so a couple of things, with all due respect, and we get along very well, we have a great relationship. This has been studied, because when I was doing the research on this, the studies are already there. There's already been studied from Harvard and other well-known hospitals and clinics, and we know that kids that are on SNAP are actually have a higher obesity level than kids in the same income bracket that aren't on SNAP. And that's because they're being targeted by people that wanted to get this, like I said, $12 billion in soda. But to the senator's point, there actually are people on this program that are not supposed to be there. They don't belong there. So some people, because there's a work requirement in this as well, but we also have to go back and we have to make sure that everyone that's on it actually qualifies, because right now we are at about an 8% error rate, and the federal government is going to send us fines of almost $8 million. And if we continue down this path and our error rate increases, that's going to double to $16 million. So it's very costly to us right now to not dig into this and make sure that we reevaluate it and have the people that really do qualify be on there. But also there's a cost savings here for us too. As you just said, like there's an obesity crisis, but that goes with a medical crisis. So for every dollar that is spent on administering this program, even when it comes to the grocers and changing their point of sale system, which is something they're balking at, but it's something they do every week. When you get your weekly flyer, it's different every week. There's actually a cost savings of $3.3 per dollar spent on administrative costs. For the city of Manchester, that means that it would save us $1 million on medical expenses. So all that food, that obesity, that unhealthy living, that translates into medical costs, and we have a savings for $1 that we spend on to administer this program is going to save us $3.3 on the other side.
Now, when Senator Rochford said earlier this week, it's a lot easier to say no junk food than it is to make no junk food happen, I was like, man, I can relate to that as a parent. But, that's usually not you at the State House, right? You think government should be smaller. Why should government be dictating this decision in this case?
This is a government program that's already dictated, right? There are already things on there that you can't use SNAP to buy. So we're just looking at that program. We're also looking at what's coming down from the federal level, telling us that we have to rein this in. Our error rate is too high. We're giving it to people that actually don't qualify, and it's going to cost our taxpayers millions of dollars because the department has an error rate. So this is already a government program with guardrails on it. We're just looking at these guardrails and saying, you know what, maybe we need to tighten it up a little bit, because it's actually any government program, right? If you re-examine it and say it's not doing what it's supposed to do, you have to reevaluate it and recalibrate it. And that's what we're doing here. We need to recalibrate this program for the health and well-being of the families that are the most vulnerable in our communities.
And quickly, as we wrap up here, this bill was amended to be a commission to study it now. So this is something that you favor and that you would like to change on the floor. So
yeah.
I was going to say, where's this one headed? And quickly, Senator Prentice.
I'm going to tell you why I favor it. The bill is introduced, and respectfully, would change the eligibility under the federal poverty levels from 200% down to running around 137-ish. So 15,000 people, that's 7,500 households, could potentially not be eligible for this program anymore, which creates more food insecurity, because nutrition is everything. And I understand the candy and soda approach, but let's keep ourselves drawing at the big picture. Also, when we talk about the error rate, we're right on the edge of that. But what it says nationally is that when you change administrative requirements, like in here, having to do different cross eligibility checks, say with HUD, and do it manually, it could actually raise that error rate because it's not as exact. So let's focus on bringing that error rate down by not changing so many things that it puts it on that edge.
All right, and floor fight here, this bill is going to get changed?
Absolute floor fight, okay. Watch for it, and I'm going to flip this bill, and we're going to do what's right for us.
We'll see what happens.
We'll
All right.
find a way to work on it
Senators,
together.
Thanks so much for joining us today. We appreciate the time, and no junk food here in studio.